When is a parent born? When your world changes in a moment? Nani? Or when the moment is celebrated by all? When you start learning again? Or with a new role? Is it your child's first breath? Or is it just a feeling? Parents are born when they fulfill a responsibility.
Your child's umbilical cord blood can provide protection from 80 life-threatening diseases. Keep it safe with Asia's largest stem cell bank, Cordlife. One chance, one choice.
Good morning, everyone. I am Sumit from Cordlife. Cordlife is a stem cell banking company. Now here we are with Dr. Bandana Yadav, who will be giving you a brief session on the antenatal exercises. So topic is quite interesting. Please share all your queries in the mid of the session or in the last of the session. Thank you so much. I am handing over the session to Dr. Bandana Yadav. Dr. Bandana, please.
Hello everyone, good afternoon to all the expecting mothers. So today here with a webinar with a topic of all about labor, challenges and coping techniques. Okay, so we have kept this topic so that we can prepare you and you can we can just easy out you and we can cover all the questions because there are lots of questions in the mind. So here, all those things we have kept this topic. Okay. So first of all, I will be telling you why it's important and understand it and how it is going to help you. Okay. Like you all are aware that previously the normal delivery, that is a natural process that used to be very frequently. Okay, cesarean used to be very less. So it's just because of the lifestyle. Okay, our lifestyle was different. Nowadays, the lifestyle has been changed a lot. Okay, and it's not our fault because we have to go through generation. Okay, by modifications and by developing technologies, we are used to have like easier things and most machines, okay, to easy our work, and that not only helps us easy the work as well as it reduce our time also. Okay, so definitely we will be going with the generation only, and what we are lacking is the physical activities. Okay, like previously, what used to be women used to do all the household activities sitting on the floor. Okay, they used to sit on the floor very frequently, and they used to do so many core activities. Okay, so that is the reason which is lacking now. I'm not saying that we should leave all the works and do household activities, but yes, we can include a few exercises, okay, so that we can make our body little bit flexible, okay, and we will be prepared for that. Tell you an example. If I'll tell you tomorrow you have to run a marathon of 21 meters, so will you be prepared? No, there will be muscle injuries. Okay, there can be a muscle strain. So because suddenly if I'll tell you to run, it is not possible because we were not doing it earlier. So for everything, our body should be prepared, and labor is one of the things. Okay, so pregnancy, it's not a small time period, it's a total 9 months. Okay, so suddenly you're going for a labor, so your body should be little bit prepared, because once your body is prepared, at the back of the mind, you know that yes, I know what is going to happen. Okay, so if you are knowing the science behind the labor, and you are knowing what to do, and how I can like easy myself by doing deep breathing, whether changing the position, anything. Okay, so that is what I will tell you today. Okay, what you can do at that time, and it's not only like I'll tell you today and you will be trained. No, it takes time. It takes several classes. Okay, that is why nowadays there are antenatal exercises that prepares you for the labor. Plus, there is a Lamaze classes. Okay, most of you will be knowing about that. Lamaze classes not only includes you the preparation, but yes, it will make you confident. Okay, not only the mother as well as the husbands, because it's a responsibility of both the parents. Okay, so Lamaze classes prepares mother and husband both. So once you know the science behind it, and you know the all the stages, process, so you have confidence that yes, I know it is going to happen, so I have to do this. Okay, and at that time, if someone guides you, so you do in a good manner, because you know you have been taught earlier that yes, these are the challenges it can come, and like breathing techniques we make you practice. Okay, so we tell you at that time, so you know how to do. Okay, so you can do it more precisely. So this is how it is going to help you during the labor. Okay, so this was a small explanation so that you can know the importance of this. But as my topic is about labor, so I'll be starting the presentation. So I will be telling you what is a sequence like, what is to be take care. Okay, so let's start the presentation. As you know, the topic all about labor, challenges, and coping techniques. Okay, so first of all, there are physiological considerations. Okay, so again, I'll tell you the same thing. Yes, there should be a mental and physical preparation for the childbirth. Okay, so this can be only possible when your back of the mind knows, yes, my physical health is okay. Okay, so I can do it. Yes, because self-counseling, self-motivation is must. Okay, it's okay. Like your surroundings, your doctors, your near one, your loved one, all motivates you, all encourage you. But most important is self. Okay, so you should make yourself strong, yourself understand. So for that, mental and physical preparation, it's must. Okay, second is socio council cultural values. Okay, socio cultural values, again, yes, society. See, sometimes what happens, there are some myths also, and some bad experience also, like your friends or someone else, your elder ones, who tell you yes, it's very painful, it's like that, like that. So somehow you also feel that yes, it can happen to me also. So it's not like that. Okay, because every pregnancy is different, and people to people, your body structure, your pain threshold, that all varies person to person. Okay, so it's not that he or she tells like that it will happen like that. No, if you have any queries, you can ask your gynae doctor. Okay, they will be advising you the best thing. Okay, they will explain you the actual thing. So previous experiences, yes, again, sometimes what happens, some pregnant women who had some previous bad history. Okay, it can be anything. Some like I will not mention, but yes, you can understand some bad experience. It can be during the process or during anything. And sometimes after doing that much effort, you have undergone cesarean. So you should not disappoint at that time because it's very important for the like new one to come and your health also. Okay, so it's not like that every time it will be like this. Okay, so to take a right decision at a right time is the only thing you should think. So the best person to take the decision is you as well as your gynae doctor. Okay, so whatever your doctor says, that is good for you because your doctor knows you well. Throughout the 9 months, you're going to a doctor, so doctor is knowing your body more. Okay, so they will guide you the best thing. Then support. Yes, support is most important because see, it's okay that you are bearing a baby 9 months, but if you get support of your husband, your loved ones, your family members, okay, in hospitals there are sisters, okay, there are doctors. So if they will talk to you very politely and very nicely, so your confidence level increases more. Yes, right. So this also plays a major role. So that's why the support is very important. Then emotional status. Yes, your emotional status also varies. Um, you all are aware that yes, our emotional status is something else with the family, something else with the nearby. So it depends. Okay, so everything getting together, if it is okay, so definitely you will be having very like confident. You will be having lots of confidence, and your energy level will be also good. So admission to the labor suit. First of all, history. Yes, history is very important. Okay, because on your history, it depends how you're going to like cope up the labor stages. Because history, like you have a gestational diabetes sometimes, okay, or something else, even hypertension or thyroid. So many other things are there. That is very important. Okay, because once the history we know, so it's easier for us to see that is there any fluctuation or because normal delivery takes lots of time duration. Okay, from 6 to 12 hours, 12 to 24 hours sometimes. Okay, so that's why during this time duration, if you know the history and all other things, so it makes us it's easier. Okay, contractions, yes, definitely during the labor time because it's a lot like long duration, so contractions is also very important. Your contraction, is it slow or like your frequency, intensity, everything depends. When they last ate, okay, when you had your food or anything you have ate, that also depends. Then vital signs, yes, in vital signs, your comes your this SpO2, your oxygen, your saturation level, your BP, your heart rate. Okay, so everything is to be noticed. Ultrasound, yes, your ultrasound report again, because knowing the baby's position is very important. Okay, because this helps a lot once what happens if the baby is having cord or the baby is in breech presentation, or any so many things are there that can be seen in the ultrasound. So that also helps. That is why it is very important during admission. Okay, then examination. Sorry, examination that our doctor, our sister does. Coming to the stages of labor. So just okay. So stages of labor. There are 4 stages. Okay, so I'm not going to elaborate it, but I'll just give you a gist. Okay, in a brief, I will explain you. First is the stage of cervical dilatation. So it begins with onset of regular contractions and ends with complete dilation. Okay, in the latent phase, active phase, transitional. So there is a dilation of 0 to 10 centimeters. Okay, so it takes several times. Okay, like in the latent, in the starting, there will be a 3 centimeters. Then in the active phase, it's 4 to 7 centimeters. Then in the transitional state, it's a 8 to 10 centimeter. So it's a first stage. Then second stage is stage of expulsion. Okay, yeah, it begins with the complete cervical dilation and ends with the delivery of a fetus. So, sorry. So, stage of expulsion begins with the complete dilation and ends with the fetus delivery. Okay, then this. Okay, placental stage. So begins immediately after fetus is born and ends with the placenta is delivered. So after the fetal delivery, there is a delivery of this placenta. Once it's come out, so this stage ends up. Then your next stage is maternal hemostatic stabilization. Okay, stage. This begins after the delivery of placenta and continues for 1 to 4 hours. It depends on person to person. Okay. So fourth stage is most important because it's a recovery stage. Okay. So as I told you, the dilation progresses as the time duration progresses. So in the starting 4 to 24 hours, it is 0 to 3 centimeters. Active phase 4 to 7 centimeters, 3 to 5 hours. Then transition 8 to 10 centimeters, half to 2 hours it is. Then physiologic forces of labor. Yes, physiologic forces of the labor depends on the frequency of contractions. Okay. Yes, frequency of contraction, effectiveness of pushing. So definitely, as I told you earlier, that energy level should be good, because effectiveness of pushing comes only when you have lots of energy, have lots of confidence. Okay, then because when and how to apply a pressure, that also depends. Otherwise, you will be exhausted and your energy level will come down. Then cues to contractions. Frequency, how often, and duration, that is a how long. So can you figure out duration, intensity, and frequency? This is what we train you during the Lamas. Okay, so in Lamas classes, we train you when and how to apply a pressure so that you should not waste your energy. Okay. Then for this, you should know that birth passage also should be good. Okay, like several things depends on it, like size of maternal pelvic, type of maternal pelvic, ability of cervix to dilate, ability of vaginal canal to distend. Okay, see, size of the maternal pelvic also depends because sometimes the size of pelvic from where the baby, your fetus will be coming out, it should be sufficient. Okay, because sometimes there are some congenital like abnormalities also. Okay, bony, and sometimes accidentally, like anyone having a pelvic bone fracture or hip bone fracture. Okay, so all these things depends because your pelvic, your hip bone, all should be in a normal pattern so that during labor it should not hurt you and your baby. Okay, because just going blindly for a normal delivery, it's not a healthy practice. Okay, so for this, these things like comes in your history. So proper history to your doctor is very important. So ability of your cervix to dilate. Again, yes, lots of women say that yes, they are having lots of pain, labor pain has been started, but with the pain, there should be ability of cervix to dilate also. Okay, because if everything goes in a sequence, then only it can be a healthy delivery. Okay, and yes, ability of vaginal canal to distend. Again, it comes like your pelvic floor muscles and all. So again, I'll tell you, you can just do some exercises so that your flexibility of the pelvic bone and ligaments, tendons. Okay, there are lots of ligament and tendons around your pelvic bone because it's a cage. Okay, it's a cage like. So bony to bony structures are joined by the this ligaments only. Okay, so that's why there is very less flexibility. So we need to make it more flexible by doing some exercises I will be mentioning further. Okay, so uh, going next, dilation and effacement. I have mentioned a picture. You can see it. That will show you an idea. Okay, so yes, it's undilated. Okay, this is partially dilated and this is fully. That is what we need. Okay, so just going to the methods of pain relief now. We have discussed lots about the labor. Okay, and I hope you all are understanding also. So next comes the pain. That is the most important. Okay, like every women have in their mind that yes, it's all about pain only. Okay, so now we have so many other methods that can definitely it will not vanish your pain because we are not going to do any magic, but yes, it can ease you off or it can decrease your pain threshold. Okay, and the most important is the this childbirth methods. Okay, because we will make you enough confidence, so you will be knowing yes, I have to bear the pain. So by doing some breathing techniques, there are some relaxation techniques. Touch, yes, touch is also very important. It sounds very small, but yes, if you know the good touch and bad touch. Okay, if someone touches you and says you, yes, you can do, yes, you can ease off it. You can, so definitely it helps a lot. Okay, focusing attention on one object. Okay, this is also very important. That is what we always recommend you that in the third trimester, please do meditation. Okay, because in the third trimester, you have lots of stress level. There is lots of anxiety because as you're going towards 9 month, you there is lots of stress thinking that how the labor will be begin, how I will be coping, and how I'm going to like handle it. So definitely all these things again indirectly creates a tension in your muscles. Okay, because if you take lots of stress, so your muscles become very tense. Okay, but what we want to relax your muscles. That's why, yes, focusing attention is very important, and that comes by doing meditation. Okay, so you should do meditation in the last trimester. Then effleurage. Effleurage is a massage, and yes, it helps a lot. Okay, because during the labor pain you have lots of back pain. So if you have back massage, you will get back massage. So it relieves your pain. It decreases your pain. Yes, Lamas for parents we do here. So you can come here if you want to attend the classes. We can help you, or you're nearby. If they are taking Lamas classes, definitely you can go there so that you can have healthy labor. Okay, so factors affecting mother response to pain in labor. That is preparation. Again, knowledge, confidence gained during childbirth classes, it prepares you for the marathon. Okay. Second is cultural influence on expression of pain. Yes, again, as I told you, that cultural influence is a lot. Okay, because what your surrounding says, what your family members says, that also influences. Maternal fatigue, anxiety, sleep deprivation. Again, it affects because maternal fatigue is always there. Second thing, anxiety. As you go nearest to the labor time, there is lots of anxiety. And yes, during the last trimester, you have lots of discomfort in your body due to the growing uterus. So there is sleep compromises also. Okay. Then previous experiences with pain. I have explained you earlier also this thing. Yes, females who are having second NVD or the first one which they tried and undergone cesarean. So that is their previous experiences with the pain. So sometimes they are very apprehensive, and sometimes if throughout the pregnancy they have back pain or some other abdominal discomfort or pains, so again they are very much afraid of the natural delivery, that is labor. Okay, so these all counts, these all are the major factors. And support, of course. Basic principle. Okay, this will be helping you to ease your labor. Comfortable position, chest breathing, verbal and non-verbal cues, cleansing breath. Okay, so these are the basic principles, like in the stage 1 that of the labor, you can just have a walk, you can walk around, so that your muscles should be moving, your circulation will be good. You can even use vestibular physio balls. Okay, and you can just sit on that, you can rest on that, so that all helps you, because changing position makes it more easier and helps in dilatation also. Okay, chest breathing, there is abdominal breathing, chest breathing, diaphragmatic breathing, lots of breathing techniques are there. So you can have precise chest breathing, because once if you have huge pain in your body, so your breathing pattern changes. Okay, so that is what you have to learn, that you have to cope yourself at that time, that yes, I have to breathe like this, that this is the correct manner. Okay, like you take a deep breath from your nose, so your tummy should expand, and you breathe out, it should go in. Okay, so rhythmic chest, yes, your breathing pattern should be rhythmic. There should be a rhythmic chest. Okay, shallow chest, pan flow, exhalation, pushing. This all comes in that. Then pain management. Yes, that was non-pharmacological, like using physical techniques, conservative techniques. Yes, there is pain management in analgesics also, but that depends on the time, effect on the labor, and common medicines are also there that can be used. But yes, it will again depend here on your doctor, because the doctor is the your doctor is only the right person to decide at that time. Yes, when to give a medicine, or what will be the effect of that on your labor. So let them decide of this. Regional anesthesia, yes, nowadays epidurals have been come. Okay, that also reduces your pain. So again, yes, your doctor can decide it more, because some side effects also sometimes it is there, not on every females, but it can be. So accordingly, they will decide, and they can tell you the better thing. Okay. Again, yes, nursing care related to an epidural. If you're going for an epidural, yes, preparation comes first. That is assessing the platelet counts. It should be normal. Empty bladder should be there. Assessing the vital signs for baseline, IV fluids. So these all are the preparation that they will be taking care. Okay, it's not just that you are going for epidural, so they will just give you. Okay, everything has a preparation. Then in following, assess vital signs, especially the BP, because the main thing is the BP, because the main side effect is hypotension. Okay, once your BP is going lower, again there is lots of weakness. Okay, so this is very important. Then rotate positions between right and left sideline. Okay, assessing bladder and catheterization as needed. Then assessing for another other side effects and intervene. Okay, so next is part lactation. Yes, it is also very important, because once the labor has been done, the hormone oxytocin that started the process of the childbirth has several other effects also on the body. Okay, so like research indicates that it plays a major role in establishing maternal behaviors in the women, in the mothers. Second one, stimulates the muscles of the cervix, vagina, and uterus, helping them contract after delivery. And it also works in conjunction with a second hormone secretion from the pituitary gland, that is prolactin, to make and secrete milk from the mammary gland of the breast. Okay, and this process is called lactation. So labor ends, that means your main work starts. That is a lactation. Okay, because breastfeeding is your responsibility. So the first secretion from the breast is called colostrum. It is sticky and a milky yellow color. It not only provides baby with a perfect nutrition and is easily digestible, but also contains immunities from the mother. Okay, so that's why it's very important, the first mother feed. That is in normal delivery, it can be given just after 1 hour, and in cesarean it can be given after 3 to 4 hours. Okay, so this is what is all about labor. Else, if you want to go more in detail, like I will be discussing this relaxation position little bit again more, because that is the main thing. Yes, relaxation techniques. Because these relaxation techniques, not during only the labor it helps, but also during the third trimester. Because like fatigueness or like back pain that starts after this 30 weeks, 32 weeks. So you can have like massage, kneading, or you can just relax on your physio ball. Okay, and as I told you, yes, there is a sleep disturbances also. So you can have foot or wrist massage, that also helps. Okay, and that really helps. And yes, husband support is most important. That is what I'm telling you again. So that if you're going for a Lamaze classes, or if you're planning for antenatal classes, aerobics, Pilates, anything, so we do train your husband so that they can help you. Okay, because if husband helps, so you have more confidence, because after parents you have more confidence in your partners. Okay, so that's why you can take advantage of the Lamaze classes, so that you can be mentally prepared for the labor, and you can easily cope up, and you can do the breathing techniques which we trained in Lamaze classes, and you can just easy your labor. Okay, so we end the session, and you have any questions you can ask regarding the labor, because there are lots of questions in the mind. So
Viewers, please post your questions on the chat box. Dr. Bandana Yadav would be very happy to answer your questions. We are waiting for your questions.
yes, question is coming. So its first question is by Priyanka Mishra. I'm in 7 months, so need to know the sitting positions. Okay, so Priyanka Mishra, yes, you can sit like, if you have any other concern like back pain or something, that you are asking sitting position, or normally like that. Okay, I'll tell you the both things. Okay, see, if you have a back pain, or you are working, so definitely if you are sitting for a longer duration on a chair, so you can have one pillow, okay, at the back, and so that you can maintain the straight position. Okay, and sitting for a longer duration, it's not that you will be sitting like this or this. Okay, just sit straight. Your earlobe should fall on your this shoulder. Okay, and it is recommended that if you're doing any work, any laptop work or any reading things, so try to sit on the chair so that you can maintain your this posture. Okay, other than just sitting on a bed or on a sofa, definitely we come in our easy manner, because always body tries to be in a easy manner. That's why. Okay, so you can just sit straight by using the pillow. Okay. So next question is by Mrs. Pooja Sharma. How we will breathing exercise? Okay, yours is 7 months is going on, and how you will be doing the breathing exercises? Yes, Pooja Sharma. Definitely, breathing exercise is always safe, and I will be telling you few breathing exercises, and you can do that. Okay, breathing exercises you can do even from the day one of the pregnancy, and other exercises you can start from the second trimester. So simply there will be only one pattern of breathing in all the exercises. That is, you will be taking a deep breath from the nose and breathing out from the mouth. Okay, so you can do abdominal breathing. So when you will be taking a deep breath, your tummy should go in. Okay, and breathe out from the mouth, your tummy should expand, it should come out. Okay, so this is a normal breathing technique. Then coming to the diaphragmatic breathing, that is your this dome shaped muscle. So you can stimulate your diaphragm by placing the hand, and you will be doing the breathing as I told you. From the nose you will be taking a deep breath. Just inhale, exhale, okay. So placing hand, you will be stimulating that area, and you will be doing in a better manner. Third one is, you can just keep your hand straight or sideways, and you will be lifting your shoulder up while taking a deep breath and bringing it down. Okay, so like this you can do 3-4 deep breathing exercises. I hope you understand all the exercises. So next question is by Mrs. Sumanta. Yes, what are the side effects of painkillers? Okay, painkillers used during normal delivery. Okay. See, again, Mrs. Suman, it depends on what and which painkiller you took. Okay, and if you took the painkiller by the permission of your doctor, so you no need to worry, because they will tell you the better one only. Okay, because they know what is good for you and what is bad for you, and definitely they will not recommend you the painkillers that will be harming your placenta or your baby. Okay, generally they used to give you this paracetamols or like light medicines only. Okay, and that doesn't affect your this normal delivery, because it's a simple medicine, simple salt, that will be not affecting your muscles. Okay, so next question is by Mrs. Pooja Goyal. Yes, it's my 7th month going on and I still have posterior low lying placenta. In this case, is normal delivery possible or not? Yes, Mrs. Pooja, your gynec doctor is the right person. She can tell you the right thing about what is to be done, because throughout the pregnancy I mentioned again and again, because the same thing, because your gynae doctor is looking after you from the day one of the pregnancy. She knows all the reports, all the ultrasounds, and somehow your physique also. Okay, so that depends. Plus, at the delivery time or the last ultrasound reports also matters, because it's not necessary that from the starting you have a low lying placenta, so it will be having till 3rd trimester. No, as you told, it's your 7th month going on, so still you have 2 months. You can go for good exercises, because if you will do some pelvic exercises, some lunges, okay, or some other exercises that will be involving your pelvic movement. So what we are doing, that we are moving the pelvic, so your uterus will be getting space. Okay, so your baby also moves with that. Okay, so don't do any exercises blindly, as it's a posterior low lying placenta. So your gynae doctor can tell you few exercises that can be done for that, and rest your gynae doctor will recommend you the correct thing. Okay. Next question is by Mrs. Kanchan Adhikari. Okay. Is normal painless delivery anesthesia is safe? Normally, people does not opt for it. What would be the reason? Yes. See, normally painless deliveries, it's not totally painless, but yes, it reduces your pain. And yes, anesthesia is safe, but not that much extent. Okay, again, it depends on your gynae doctor with and which anesthesia they are giving and at what time they are giving. Is it required or not? Again, it depends. Okay, so it's like that because definitely if you are reducing your pain, so you are either you are getting this epidurals, okay, that will block your pain. And yes, what is happening if you are getting the pain with that your contractions and your pushing efficiency that also increases. That's why a little bit pain is also required. Okay, and yes, normally few people, as I told you, they have a myth. Some people have their own bad experiences. It's not necessary it will happen with you also. Okay, so these all things are there that is to be ruled out, and this you can rule out with your gynae doctor because ultimately whosoever is your gynae doctor, you can ask them because they will tell you according to your body state and according to your physical body status. Okay, because they know everything about you, your reports, your experiences and all, your history as well. Okay, so next question is by Mrs. Gauri Mukund. Yes, I am in my 8th month having difficulty in sleep in both the sides, left side, right side, and especially at night my tummy gets stiff and I feel very difficult while breathing. Okay, so Mrs. Gauri, yes, definitely what all you are suffering, that is like very normal this time because almost 99% all the pregnant women experience the same thing in the 8th trimester because there is a huge changes in your body. So definitely you will be having a discomfort, but anyhow you have to find the right sleeping posture. You can keep pillow between your leg in the sideline, so it will give support to your pelvic. Okay, so instead of using simple pillow, you can have that square wedge pillow. Okay, that is parallel and that will keep your legs parallel, and indirectly it will support your this pelvic also. Okay, so when you will get proper support, so it is much easier. And yes, if you are like having lots of discomfort, so you can place one pillow at the back side of your back spine. Okay, that also helps because if you will be resting slightly back, so anyhow that also a position you can go for. Okay, and yes, next one what you asked, especially at night and my tummy gets stiff. Yes, tummy gets stiff because now there is no that much space and your uterus is pressing your intestine also. Even it is pushing your ribs also upwards, it is pushing your organs. So you can do the breathing exercises as I told you. You can do abdominal breathing, you can do diaphragmatic breathing, you can do your overall thoracic expansion as I just now shown you. Okay, so if you will do these things, it will stretch your ribs, so this will relieve your pain and discomfort. Okay, so you can do the breathing exercises, it is always safe. Next question is from Mr. Rahul Gupta. It's my 36th week and cord is around fetal neck. Is normal delivery possible? See, yes, normal delivery is possible, but it should not affect the baby's neck. Okay, that is why to reduce these like calamities, okay, and to reduce the bad effects on the baby, we don't recommend normal deliveries. And with this, uh, it's 30 weeks, 36 weeks. So you have little time. You can do few exercises. Maybe by the baby movement, because it's only, I guess, cord is around fetal neck. It's only one. So maybe it can be okay. Okay. So you have time. You can do few exercises, pelvic exercises, lunges, and all by consulting your antenatal expert, whosoever there is nearby. Okay, so if it's only one cord loop, so maybe it can be corrected and it can be a good normal delivery. Okay, but if it is not corrected, so your gynae doctor will be deciding what to be done, because again, only this is not kept in the mind for us. They will be seeing the reports and other more factors also. Okay, so they will decide. And the possibility I told you that yes, it is possible, but if it will harm your baby, so again, it is not good. Okay, so next thing is you can do few exercises and maybe it can be corrected. Okay, next question. Okay, is by you only. I have difficulty in breathing in pregnancy from first trimester, so it can be because difficulty in normal. Oh, it can cause a. See, it is not like that. Yes, definitely. If you have breathing difficulty from the trimester 1, so you should find why you are having that discomfort. Okay, if it is there, so yeah, you might have done breathing exercises from the trimester 1, or I don't know whether you have any respiratory problem or any history of breathing discomfort or some other discomfort you have not mentioned. And if you have no any history of respiratory distress or respiratory problem, so definitely you should practice more for breathing. Okay, that is abdominal breathing, diaphragmatic breathing, thoracic expansion. So it can make you easier by deep breathing. You will get lots of oxygen, and again it will stretch your this ribs. You will get flexibility. So you can try breathing exercises. This helps unless and until you have any medical problem of breathing. Okay. So next question is from Mrs. Priyanka Mishra. Changing gynae doctor at the end of 7 to 8 months is okay because of distance. Yes, Mrs. Priyanka, definitely if you have no other options, so definitely you will be changing the gynae doctor only. Na? So it's so as soon as you can change your gynae doctor, then you can as soon as go to the doctor so that you can show all the previous reports, okay, and everything. You can tell to your gynae doctor if you have any problems, any other histories, any other medical histories, any surgeries, because telling everything your gynae doctor is must. Then only she can take care of your. Then only she can guide you the right thing. Okay. So yes, because of distance, if you want to change a doctor, you can. But having all the previous reports with you. Okay. So I think questions have been completed. So no more questions are there. Okay, then we'll close the session today then. If you have any other further question, you can contact Motherland Hospital, or you can just leave the questions through the email or some other measure. This Cordlife will helping you. Okay, so okay, take care, all the expecting mothers. Bye bye.